A permanent brow drop from temple filler. Recently, I came across an awful injury that a patient suffered from a temple revolumization procedure. This procedure was done with a cannula, and the patient suffered immediate brow asymmetry that we thought would recover, but unfortunately just persisted. Now, several months in, the patient still does not have movement on one side. So how could this happen? I think there's a lot to unpack with how cannulas can potentially affect patients when used in the temple region, and we can compare and contrast this with what might happen, or the likelihood of what might happen, using the so-called gunshot technique. So let's think about the anatomy of the frontal branch of the facial nerve. So this nerve emerges from underneath your zygoma. It passes through the masseter muscle, comes up through on top of the fascia of the muscle, and then makes its way up into the temple. Now, when it makes its way into the temple, it is coming up through the layers, and it eventually will pass into where many people will place a cannula to revolumize. And this is why it's actually quite common to have some effect on the nerve, but it's usually temporary.